okay? So the typical cartoon shows about the touching of surfaces and how particles go. But here's what I want to bring home to you, right? This is very important. Please keep this in mind. Please, this is very important, right? It's primarily spread by respiratory droplets. This is coughing, sneezing, talking, and the droplets are in heavy water and they drop out pretty quickly. So the limit of a droplet distribution is usually less than 6 feet, about 2 to 3 feet. Now you may hear about somebody say, well, I heard that in dry air, right? It dries it out so it can travel greater distance because the air is lighter. Okay, this is certainly possible. But also if you get into drier air, you can imagine that the water content with it is going to be less. The amount of cells that it's with are less. So it's going to dry out more easily. They're going to become less viable, okay? The other side, aerosols. Aerosol is where the size of the particles are so small, less than 5 microns, that it can go longer distance, okay? So there are 2 well-cited examples in the literature for this. 1, Skagit Choir. This is up in the state of Washington. And 2, a particular restaurant in Guangzhou, China. In both of those scenarios, what happened was in the choir, you can imagine, there's people standing next to each other, they're singing next to each other, they're in an enclosed room. That's a setup for aerosolization, where you've got tiny particles, but there's enough of those tiny particles floating in the air in that room that it's going to cause infection. The Chinese restaurant. Turned out that the way that the restaurant was situated, the way that people were seating, the way that there was intake of air and output of air, that it was able to circulate in a small area. So not everybody in the Chinese restaurant got sick, but ones that were located near the ventilation systems did get sick, right? Both of these argue towards aerosolization, right? Well, that becomes critical because aerosolization, those tiny mists, that very light particles, those can travel farther. Those can potentially cause infection, but there's some problems with knowing how to deal with that. What's some of the problems? Well, first of all, aerosols, because they're very small, it's very hard to test them. It's very hard to know what's really in them because they're so small that you could see pieces of virus, but not live virus, right? Aerosols usually last in a room for 2 to 3 hours. And remember, a lot of this data comes from the medical world where we're doing procedures on patients. This is not normal. This is not what normally goes on when you enter a room, when you go into somebody's house. The chances of there being a huge aerosolization within those areas is small. It's almost non-existent. Why? Because you don't have the ongoing procedures that are causing aerosol. On the other hand, if you happened to go into somebody's house or go into a smaller room and there happened to be somebody who was acutely sick and coughing season, okay, then it's possible that there might be a chance of some aerosol contamination. Now, another reason that's so important, because if you believe that there's a significant component of aerosolization, the treatment of that is don't go into small rooms. And if you are an employer, make sure that you're checking the ventilation in your areas, because if you have larger rooms, if you have less people, the chance of the aerosol being a big deal go down. And if you are concerned as an employer or an owner, then what you could do is make sure that you contact your engineering company to increase that ventilation. Make sure it's being done efficiently. Now, why do I say, okay, well, Mark, how do you really know? Well, again, everything's in evolution. There's different sources of data, but keep this in mind. Look. Measles. Measles, we know for sure, is an aerosol infection. And the household attack rate is probably 85 to 90%. Got that? Which means, remember measles party or chickenpox parties where people would go to these things and they would be exposed and there was a high likelihood you're going to get that. Well, with Corona, it's not turning out that way. It looks like in the aerosolization, you maybe get about 10% in healthcare workers and less than 1% in household contacts, which by the way, I've seen this. I see this in a number of patients you see in the literature where there's people that say, I don't understand this. I got sick. I have the infection. I know I had it. I documented it. My wife didn't get it. My kids didn't get it. How is that possible? That's possible because aerosolization is less of a factor. If it was a clear, strong factor, then everybody in every household would get nailed right away, right? So that's the trade-off in looking at that information, right? Now, what do we talk about when we talk about these aerosols? Because this is such an important topic. It depends on the size of the particle, how long it takes until it falls to the floor. So you can see with the SARS, it could be suspended indefinitely depending on what it's with, how much moisture. But one SARS-specific study showed that 90% of virus is gone at 6 minutes in sun exposure. And this is what happens in sun exposure. So already, you say, well, wait. I thought the aerosol issue, the business, how far it could travel, has to do with the wind and the wind currents. Yes, but once you go outside, UV light kills this stuff very quickly, right? The next thing is when they're looking at aerosol, they're looking at and trying to analyze the actual mist, and what they see is that, yeah, you can recover particles or pieces of that SARS coronavirus. Like, remember I showed you the model, but you're not recovering live virus, right? So one study on SARS had an aerosol that seemed to have some viable virus at about 16 hours. And one study showed that the SARS-CoV aerosol, when it was airborne, only lasted for 8 minutes, right? So you say, well, oh my God, that's all over the place. How do you make sense of that, right? So one of the ways you make sense of that is to appreciate and understand that in general, if you're outside, if there's nobody right next to you, like on a sidewalk, right, the chances of you getting any kind of aerosol or droplet is almost non-existent. So for the vast majority of people, you don't even need a mask outside. That's just the data. That's the literature, right? But is it possible that you could be in a small closed room with a lot of people, that you just entered a room where somebody's been coughing and sneezing for the last hour and really aerosolized the place up, and they might have some viral? Okay, yes, it's possible, right? But it's far more probable that in those situations, you're not going to be as likely to get it. Again, you're more likely to have trouble with the droplets, the people coughing in proximity to you. That's the bigger risk, okay?